Medical imaging is just incredible, right? It gives us these amazing views inside the human body. But when you're talking about powerful tools like CT scans and X-rays, there's a really important question that comes with it. How safe are they? Today, we're going to pull back the curtain on the unseen systems and the dedicated culture that make modern medical imaging remarkably safe.
So let's just get right to it. The big question that's probably on your mind if you're about to have a scan. Just how safe is this, really? And you know what? That is a perfectly valid question, especially when you hear the word radiation.
And look, let's be real. Medical imaging is a major source of our radiation exposure today. But that's not some secret the medical community is trying to hide. It's a known risk, and they have built an entire safety framework to manage it, all because the diagnostic benefits are just that important.
Think about it. We're all exposed to natural background radiation every single day. It's just part of living on Earth. But here's the striking part. Medical procedures now contribute almost as much to our annual dose. And that reality is exactly why this powerful safety philosophy is so absolutely essential. So, how in the world do medical professionals manage this risk? Well, they follow this one single powerful guiding principle. It's called ALARA. And honestly, it's kind of the hero of this whole story.
So what does ALARA even mean? It stands for as low as reasonably achievable, and that's key. It's not about getting to zero radiation, because then we'd lose all the incredible benefits of these scans. Nope, it's all about optimization. It's about using the absolute minimum dose needed to get a clear diagnostic image. And ALARA isn't just some vague idea, It's a real system with built-in tripwires. Let's just spend a moment with this table, because this is where the rubber meets the road. These are called investigation levels. If a staff member's exposure hits just 10% of their quarterly limit, that's ALARA level 1 you see on the left, bam, it automatically triggers a safety review. It's this super proactive early warning system designed to catch any potential issues long before they ever become a real problem. So who's the watchdog here? That would be the Radiation Safety Officer, or RSO. This person's entire job is to be the guardian of the ALARA principle. They're constantly monitoring, reviewing data, and they have the full authority to step in and make changes to make sure everyone, both staff and patients, is safe.
All right, so we've talked about the principle, but what about the results? Let's see how ALARA actually plays out in the real world, protecting the healthcare workers on the front lines every single day.
And wow, the data here really tells the story. Look at this. A staggering 98.8% of diagnostic radiology staff receive an annual dose of less than 1 millisievert. That is an incredibly tiny number, and it's just powerful proof that these safety protocols absolutely work.
Now, over in nuclear medicine, things are a little different. Staff there work more directly with radioactive materials, so the doses are a bit higher, as you might expect. But even here, they are managed so meticulously. The vast majority of workers are still staying well below the annual limits. It just shows that ALARA isn't a one-size-fits-all rule. It's adapted for every single situation. Okay, but this commitment to safety, it goes to a whole other level when we talk about pregnancy. This is where you see just how serious these protocols are, with a special focus on protecting expectant mothers and their developing babies. As soon as a worker declares a pregnancy, a really strict dose limit kicks in for the fetus for the rest of the term. Just 1 millisievert. And let me be clear, that's not a goal, that's a hard ceiling, a line that cannot be crossed. And to give you some perspective on what that 1 millisievert actually means, the average person just walking around gets about 2.2 millisieverts every single year from natural background radiation. So the safety limit for a fetus is less than half of what we all soak up just by living on planet Earth. That's incredible. So how do they make sure that limit is met? Well, a worker's duties are proactively changed. It's all common sense, really. This could mean they stop doing hands-on things like patient injections in nuclear medicine, or maybe they cut back on work involving higher energy scans. It's all about taking practical steps to minimize any potential exposure, period. But a true culture of safety is about so much more than just radiation. It's this whole holistic approach to protecting every single person who walks through those doors. And as imaging gets more and more complex, with procedures that are a bit more invasive, infection control has become another absolutely critical pillar of that safety. It's really about preventing harm from every possible angle you can think of. And this slide gives you a perfect snapshot of the kind of detail we're talking about. Every single injection follows this strict playbook. You've got your single-use needles, you're disinfecting the vials, and there is absolutely no sharing of syringes. These aren't just good ideas. They are hard and fast rules that create this vital barrier against infection for every patient, every time.
So when you boil it all down, the takeaway is pretty clear, right? We can put our trust in these amazing diagnostic tools because there's this unwavering, multi-layered commitment to safety behind them. It's the very foundation that allows modern medical imaging to be both incredibly powerful and profoundly safe.
And that kind of leaves us with one final big question to chew on. As this technology keeps getting better and better, what does this deeply ingrained, almost invisible culture of safety mean for the future of medicine? You have to wonder, right? How will this bedrock of trust and protection allow us to push the boundaries of what's possible even further?